So I just thought I would do a quick video on what makes a good history. A good history is going to be where you're clear and concise and you want to ask open-ended questions. You don't want to be that specific. So first of all, always hand wash. You're going to fail the history if you don't hand wash. Say who you are. I'm a second-year medical student. Today I'll be taking a history. Is this fine with yourself? Can you please identify your name, date of birth, and where you are? And then go into the history. So always start off with how can I help you today? And then after they say their little blurb, because the patients usually want to get their feelings off their chest, then you go into Socrates. So Socrates helps you narrow down what is actually happening. So the site, onset, character, radiating, alleviating factors, timing, exacerbating factors, severity. Please note that this does not have to be in order, but a good history is not going to jump around from past medical history back to Socrates, back to surgical. You want to usually follow this order. So after Socrates, you have a general idea of what the presenting complaint is, what's happening, how is the pain, how are they feeling, and in a hospital setting, maybe then you would just go straight to medications or consult your supervisor. But at a university level, especially from year 1 to year 2, you're just trying to collect as much information as you can. You're then going to ask them a very one quick sentence on their ideas and expectations. This is not that high yield of the history, but it's something that you just need to say to get an idea of what they're looking for out of the consultation. Usually they just want their pain to go away. So the next acronym is PISS-MF. Hopefully that helps you remember. And what it is it's past medical history, immunizations, surgical history, social history, menstrual. Please remember that if it's a male patient, this doesn't apply. Biological male, and then family history. So for past medical history, think of what is their past medications, their past allergies or other diseases, what makes them them. That's what past medical history is. Then immunizations, you just need to ask, are they immunized? If they've come in with, let's say, rheumatic heart disease, you can ask them a more specific question, but at year 1 to year 2 level, it's not really required. Surgical history, so have they had any surgeries? Correlate the age for the patient. Some of the patients are quite tough and they really want you to ask them that specific question. So you can ask them something like, I notice you're 60 and you're presenting with chest pain. Have you had any cardiovascular surgeries? Have you had a pacemaker installed? Things like that. So some of the practice patients will not tell you unless you really ask them and dig deep. So keep that in the back of your mind. How old were they when they had this history? Did they have any complications? Remember, for year 1, they just want to see that you can hit most of the boxes, and in later years, it gets more complicated. Social history is arguably the most important. So what work do they do? Are they supported at home? Hobbies, who do they live with? And then don't miss your smoking, diet, and alcohol. That's arguably the subsection and the meat of the social history at a year 1 level. So it's not good enough to say that they smoke. You need to ask, how much do they smoke? I think in year 1 there's a question on pack years that came up, which is essentially how many years of equivalent smoking have they done? When did they start? Have they tried stopping? And you can always add a little blurb like, I'd love to have a conversation with you in the future about quitting smoking if that's something you're considering. So it shows that you're a caring doctor, and first and foremost, you're a human and you're empathetic. Then go into their diet. So could you please describe me what an average meal looks like? Go into alcohol. Use the word standard drink. That's something the examiners do look for. And then if they say something like, oh, I have 12 stubbies. Well, what does that mean? 12 stubbies a day, 12 stubbies a week, a month? And then go into detail for alcohol like that. Sexual history, are they married? And honestly, just a couple more of these ones on top of the smoking, diet, alcohol should be fine. So for menstrual, last known menstrual period, pap smear, are they pregnant? Is this a possibility? And then you want to go into family history. So are the parents alive? If not, why? Does the disease exist in the family? Could connect to the GH. Maybe you have to draw a pedigree chart. So that could be interesting. And then very quickly do a systems review. Even at year 1 level, I would do it, because at a year 1 and year 2 level, a systems review can just be a yes or no questionnaire. All you have to ask is, are you having any vision problems? Yes or no. Any heart palpitations? No. Any breathing difficulty? No. Any weight loss? No. Any sleeping difficulty? No. And verbalize to the examiner everything before you do it, and also verbalize that, hey, I'm just going to do a quick systems review to see if I've missed anything. This is what will push you to the HT level, because you're doing everything at expected standard and you're doing a little bit more, but keep it short, because you will be, I don't want to say you'll be short on time, but by the time you finish, the clock is about to end. So again, a yes or no at a year 1 or 2 level for the systems review is okay. Super important, summarize. Say that now I'm going to quickly summarize. So just go over, you came in with throat pain after eating spicy food. I think it is GERD, and I would like to consult with my supervisor about possible antacids or a dietitian. You don't need to say that at year 1 level. You don't even need to say that at a year 2 level. But in year 2, there is something called a mini MSAT. It is good to bring up 2 possible diagnoses, explain your reasoning, and even if you're not going to say it, get into the habit of thinking, what would be the next steps? What tests could I do? Who could I talk to? Something that's really easy is, for most pain, if it's bacterial, you could just say antibiotics. CT scan can basically be done for anything if they have any, let's say, abdominal pain. So try to start thinking of what could I actually say. And I think even if you said that at a year 1 history, it shows that you're at HD level, you're thinking ahead. There's nothing wrong adding it. At a year 1 level, if you don't want to say that, don't say it. There's nothing wrong with it. But I have noticed though that once you get into a habit of taking a history and thinking what the next steps are, it does help on placement, and it also trains you to be prepared for as a doctor. Very much most of the time, we get into a habit of just memorizing Socrates and these acronyms, and sometimes we can forget what the real reason of the medicine is. It's not to hit every single point, it's to figure out what's actually wrong with a patient. So there can be a disconnect from being a good student and good doctor, but just try to keep that in the back of your mind.